In just 40 days, Karnataka's Hassan district has reported 23 deaths due to heart attacks, many of them young or middle aged people. The sudden rise has left families shaken and raised serious questions. Chief Minister Siddaramaiah has asked whether there could be any link to the COVID 19 vaccine, though the Union Health Ministry has said that there is no evidence to support that. A special team of doctors, led by Dr. Ravindranath from Jayadeva Institute, is now investigating what caused the spike. They have been asked to submit a report within 10 days. Meanwhile, the sudden death of actress Shefali Chariwala at just 42 has added to the public's concern. It was first reported as a heart attack, but police have now marked the cause of death as reserved while investigations continue. Are heart attacks on the rise? Are younger people at risk in ways we haven't seen before? And what role, if any, do vaccines, stress, or lifestyle changes play? To help us understand what's really happening, we are joined by Dr. Ranjan Shetty, one of India's leading cardiologists and medical director at Sparsh Hospitals. Thank you so much, Doctor, for joining us. So, lately we have seen that there has been an increase in the cases of heart attacks, especially with over 20 deaths reported in Hassan. That's something very serious. So, is there a reason why we are seeing such an increase in heart attack cases?
Yeah, I think when we calculate a number, it's very important to know the denominator. Just the numerator doesn't work. So all we have is some number, some 50, 20, 30 from a place. But we really don't know the population of that place. We don't know what to compare it with. So I think overreacting to a number is not what we recommend. But what I would suggest is we have been seeing young people with heart attack, that is for sure. I've been nearly practicing for 20 years of cardiology now, and I've been seeing young people getting heart attack from long time. Now, even in 2009, 2010, the youngest patient I've treated is 21 years old for heart attack, youngster. So heart attack in young is very common in India and world over, but more so here. I think we should discuss the causes of these heart attack in young, and not highlight just one area because we really don't understand the full picture there. Yeah.
So, what could be the causes? Like lately, even there have been very recent news where a young cricketer passed away while playing due to a heart attack. Actress Shipali passed away due to heart attack. And we keep seeing
Yes,
the
yes.
news about young people or even the older ones having a sudden heart attack. So, what are the causes majorly?
Okay. So to answer this, we need to understand the risk factors. I always quote this study. There's a study called InterHeart study, which was done in different countries, but India, there was a significant number of people from India, and they looked at risk factor. Traditionally, we think there are 9 risk factors for heart disease, and 90% of the heart disease in India was because of them. Although Indians get heart attack 2 decades earlier, 20 years before the Western world, but it's because of these 9 risk factors which occurs. Whenever we see a heart attack less than 35 years, 90% of them are smokers. 90%. So if you don't want to get heart attack in young, first thing is stop smoking. That's the message which should go. 90% are younger. Rest, most of them have a family history. That means they have abnormally high cholesterol in their blood, and they've had relatives who have had heart attack at a young age. So when you combine these two, you actually cover 99% of young heart attacks. 99. So basically, these are preventable. It's easy to prevent it. It's important. The real reason why Indians get heart attack in young may not be genetic. It actually is clustering of risk factors. Indians are like all or none. Either I want zero tablet or I'm okay to have 5 diseases. We are not in between people. So here the very diabetic is also hypertensive, is also smoking, he or she, they're obese, they have uncontrolled BP, their cholesterols are sky high because now they don't respect it enough. When 2, 3 risk factor combine, the risk of heart attack goes eightfold high, not 1 or 2 fold, eightfold. If a diabetic say controls their BP more than their sugar, if they control their BP, their cholesterol, their weight, their chance of heart attack is as much as a general population. But the very diabetic now is sugar centric. They only want to think about sugar, 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 but not think about the BP which is coming, the obesity, the lack of activity, and that's when they end up with heart disease and heart attack. This is something which we have seen consistently across decades.
Hmm. So it sounds like the comorbidities and lifestyle factors play a huge role. In India, we are
Yes,
very common to diabetes, and BP is something that runs across families.
yes,
So that
correct.
might be
So
the.
Indians, the Western world, diabetic is 10% of
Hmm.
population. Here it is 30 to 40. Practically every Indian is diabetic. The only way to avoid diabetes, or they're borderline, only way to avoid is if you live like diabetic. And we don't do that. Our
Hmm.
food is predominantly carbohydrate rich.
Hmm.
It is vegetarian for religious reason, not for health reason.
Hmm.
So, very high carb, hardly any protein, literally no activity. I believe these are the ones which are leading to heart attack in India.
Also, how do heart attack symptoms differ in man and woman? Do they represent the same?
This is a very good question. Very good question. I would like to answer in two ways. One, what exactly is heart attack? Heart attack is not just blockage, but something actively happening inside the arteries at that time. Heart attacks are like earthquake. That's why people who seemingly they're healthy, like the cases which you mentioned, they're healthy.
Yeah.
But suddenly, the 10-20% block which they have, something happens to them. The plaque ruptures, could be too much exercise, could be emotional stress, could be physical stress, could be smoking itself, plaque ruptures, and there is heart attack. That's how people get heart attack. When it occurs in women, it's usually atypical. We all know the classical symptom, precordial pain, pain coming to neck, sweating.
Hmm.
All this may not be there. The women could present with more breathlessness, more abdominal pain, like typical gastric pain.
Hmm.
And they could neglect the pain may or may not be there, sweating may or may not be there. So it could be little atypical in women, but heart attack is still the most important cause of death in women too.
Yeah.
The protection which women have is during reproductive age group. Once they cross it, the protection is lost. And if the women, any lady, if she is diabetic, hypertensive, smoker, or when these risk factors are present, then all the benefit of heart attack, the protection which comes from the natural hormone is lost completely.
So the symptoms are clearly going to be different in men and women.
Yes, yes,
Also,
yeah. Would be more atypical. Yeah.
hmm. Also, would it be changing in the young people like 20, 25, or below 30 years? Do their symptoms differ?
In end, the heart attack itself is a myriad of symptoms. No, it's difficult even for a cardiologist to be very, very sure it is heart attack. In your list of young people dying, there are cardiologists who have died also. Without really knowing what they are undergoing. So it's difficult. What we advise people is whenever there is something which is not normal, you might think it's gastric.
Hmm.
What you feel is not normal, please go to nearest hospital, get a ECG done. ECG misses heart attack in only 4% of cases. So please go and show it to the nearest hospital. That's what we advise most people with heart attack. Now, when you do that, 1 in 10 will only be heart attack.
Hmm.
9 will not be. 9 could still be gastric.
Hmm.
It's okay to have that. But if you don't do that, that one is something which may not reach hospital or could reach with the event. Although people are scared about heart attack, like we are discussing, this is the fear which we see in everyone. But if they have a heart attack, they'll neglect it. That is the day they think it is a gastric.
Hmm.
So what we advise is take it seriously all the time.
Hmm.
It's okay to accept that you could be having a heart attack. Go to nearest hospital, get a ECG done, have a fire escape plan kind in your mind. Daytime, I'm going to go to this hospital. Some cities have horrible traffic. So
Hmm.
you could have a different daytime hospital and a different nighttime hospital. It's okay. Don't travel too far. Be very close to your place and do a ECG.
Also, when you spoke about the gastric condition, even in actress Shefali Jariwala's case, she died due to heart attack, and though the report is yet to become, but we understand that she was on some anti-aging treatments, and she also had some gastric medications. So, do anti-aging treatments have side effects?
Yes, they could. All anything which works will have side effect. That's the first thing we should understand. So it depends. We really don't know what she was on, so it's only a speculation. But yes, there are a list of things which could be harmful to people. That doesn't mean people should not take any of those. They should take it on recommendation. But the key thing is probably she had some symptom and probably she thought it is gastric, the way you are explaining it. The only request is don't neglect any symptom. Because even today, with all the advanced technology, one third of heart attacks still don't reach hospital.
Yeah, and that's even with the national data, we have noticed that majority
Yes,
did
yes.
not reach the hospital, but they.
Yeah, majority. And also, I strongly believe that, the medical science has to advance much, much more to catch that one third. And also, it's more important for people to be proactive and that we have a system like, similar to what West has, immediate call,
Hmm,
7 minutes, ambulance or a helicopter reaches and we pick them.
hmm,
It might happen, but it might take time.
hmm.
We want people to be responsible till then.
Also, one more major thing that came up with the recent case in heart attack was there was a link. There were reports about linking it to the COVID-19 vaccine. So, do you
Yes,
believe
yes.
that there could be a link between COVID-19 vaccine and the increase or the cases of
This
heart
one.
attack?
So let's split this question into a little bit. See, during Delta wave, when COVID was rampant and it was bad, yes, the heart attack increased. Delta, the one which was probably the worst wave of all, which probably took a lot of our people. During that time, the heart attack with COVID had 10 times higher mortality than the normal heart attack. We have treated them, but normal heart attack has 2% mortality, there 20% would die. Now that's dangerous. COVID vaccine did prevent a lot of life. Most doctors are vaccinated at that time. The first wave, doctors got affected. The second wave, thanks to the vaccine, the most people who were vaccinated, elderly and doctors, actually got saved. Now it is rated, the AstraZeneca itself came out with the fact that their vaccine had little thrombotic event, which was something like 3 in 10,000. Now, when you compare it to the life it saved numerous life. There's no question about it. And all of us are witness to that. But today, 4 years later, to talk about a vaccine induced heart attack, I don't think so. We have data to show that, and I don't believe. If you ask my personal opinion, if you ask this question in 2025, the answer is no. I don't think so. There is any relation between vaccine and heart attack. I am also a little more confident now in telling that there may not be any link between COVID and heart attack now, because once it shifted to Omicron variant, we have not seen increased incident of heart attack. Today, COVID is more safer than many other, virus which we have, and that's where we are.
Also, why are we seeing heart attacks in people with no prior history? Like they may have a normal BMI. They also may have active lifestyle where they are either going to gym or are involved in some sort of physical activity. So are the current risk assessments that we used to have, are they outdated?
I don't think so. Again, we are only looking at the numerator. We are looking at number.
Hmm.
If you look at how many youngster versus the population of the country,
Mhm.
that may be a small fraction. According to me, in all studies, the denominator becomes very important. Country like ours, with huge young population,
Mhm.
we are bound to see some youngsters having heart attack. Having said that, people who are apparently fine can also have heart attack because they have minor blocks which now suddenly ruptures, as we discussed earlier on. because heart attacks are like earthquake. Not many
Hmm.
tests can predict tomorrow's heart attack.
Hmm.
But again, I'm just going to re-emphasize this fact because this is something which we see again and again. Less than 35 year, 90% of heart attack are linked to active or a passive smoking. So if there's one message from this, what we are doing, rather I would want two messages. One, yes, smoking is a strict no.
Hmm.
Second, don't cluster your risk factors. If you
Hmm.
have one thing, control it.
Right. Have an holistic approach to health rather than
Yes,
focusing on
yes,
the one criteria.
yes, yes, yes.
Also, when it comes to heart diseases burden in India, is there an consideration of environmental factors like increase in pollution, air pollution, or ultra processed food, or the sleep hygiene of people? Do these factors also play a role in heart diseases?
Absolutely, absolutely. There's no doubt. Yeah, air pollution is like smoking again. So cities with higher air pollution is likely to have more lung and heart disease. Stress has its own effect. Work-life balance is needed. Sleep hygiene is important. Now, the smartphones are addiction both in children and very elderly too. People above 60, 65 are more addicted to these sleep hygiene, sleep have not just the quantity, concentrate on quality of sleep 6 to 7 hours, 1 hour before sleeping, no TV, no mobile, try to read some books, manage your stress, take regular breaks, add yoga to your yoga, breathing, all this to your this one. So it's
Routine.
going to work well with all these factors, yes.
Also, do you believe that India is heading towards heart disease epidemic?
It's already there. It's not heading. We are already there. India has a peculiar combination of high, communicable disease and non-communicable. Heart disease is definitely we are having a huge number. Younger population, which is economically active, is suffering from heart attack. We are losing. It's a great economic and a social. Epidemic which is going on right now, but it's a lifestyle disease and it's important that we manage it well.
So, what must be done urgently to prevent this? At individual level, you've given a lot of suggestions, especially in terms of lifestyle changes.
Yes, yes, yes.
What can be done at mass level?
Yeah, I think it's still very important. Say, I think as a community, as a society, we need to be low carbohydrate. The intake of carbohydrates should reduce as a society. We need to increase our protein intake. We need to exercise very well. We need to, in India again, exercise is like either you're going to a gym and building muscle
Hmm.
or you're doing nothing.
Hmm.
There's no moderation in anything we do. I think it's important to bring moderation. It's important to make sure 30 to 40 minutes, 4 to 5 days we are exercising. And we are also adding what's native to us, like yoga, meditation. All this also could have a lot of benefit for Indians.
Even the walking, like 30 minutes of rigorous walking, would help if.
Yes, 30 minutes, simple walk, something, make it a habit, in West it's a norm for them to walk.
Hmm.
It's also norm to have a low carb diet. So
Hmm.
here we lack both of these.
Also, lastly, what can someone do when somebody is having a heart attack at the present? What are the steps that one should immediately take?
Yes, I think it's a very good question. The key thing is go to nearest hospital and take a ECG and don't try it first aid at home. Most people want to give sorbitrate, aspirin and all that, but you don't know what you're dealing with. As I told, 1 in 10 only will be heart attack. So you're delaying, you're wasting time. Go to nearest place, do a ECG, diagnose whether you have a heart attack or no. That's the first. Second, as people, if you really want to do a first aid, learn CPR because that's for cardiac arrest.
Hmm.
Cardiac arrest, most of the time, is a severest heart attack.
Hmm.
When that happens, it's important that the bystander does CPR, because within 2 minutes CPR is started. So if you love your near and dear ones, learn CPR. There are a lot of ways you can do it. We could help. The medical fraternity is ready to help anybody who wants to learn CPR. That's the only first aid you need to know.
along with, and make sure that the lifestyle is overall healthy, and
Yes,
getting to
yes,
the nearest
yes,
hospital when required. Well,
correct.
thank you. Thank you so much, doctor, for your
Thank you,
insight.
thank you.